Bismillahirrahmanirrahim. Assalamu alaikum. Good morning. I can't hear. Assalamu alaikum. Wa alaikum assalam. Thank you very much. So we can see the live audience, right? All right, so we start with the recitation of Holy Quran. A'udhu billahi minash shaitanir rajim. Bismillahir rahmanir rahim. Qul huwallahu ahad. Allahu samad. Lam yalid wa lam yulad wa lam yakul lahu kufuwan ahad. Sadaqallahul azim. It's a great honor for me. I'm your moderator. My name is Ali Faisal Salim, and I'm Associate Professor and Pediatric Infectious Disease Consultant at Aga Khan University Hospital, Karachi. Good morning, distinguished guests, colleagues, and students. I would like to warmly welcome our guest of honor, the State Minister of Health, Government of Sindh, Dr. Azra Pichu, along with Dr. Diping Lau, WHO representative in Pakistan, Ms. Aisha Raza Farooq, Prime Minister Focal Person for Polio Eradication, thank you, and Mr. Aziz Memon, representing the Global Polio Eradication Initiative from the Rotary Club. Thank you very much. We're also joined by Professor Karim Damji, who's the Dean of AKU Medical College, and an exceptional group of faculty, students, leaders from different organizations in Pakistan. Warm welcome and thank you very much for coming. Before we begin, I request some housekeeping announcements. One is to keep your mobile on silent mode, and if you have a call, maybe just go outside and receive the call. It's a live debate or discussion thing, so maybe I request if you have a burning question, which of course you will have it, so make sure that you make it short, crisp, and sweet. Note down, it should not be more than 2 questions in a row. It will be a group discussion, so I'll try to accommodate everyone along with questions I have developed, and ensure that each one of you participate appropriately. For the opening remarks, for the welcoming remarks, I would request Dr. Diping Lau, WHO representative in Pakistan, with over 2 decades of experience leading WHO operations in emergency response, communicable disease, and health security across Asia and Pacific. Sir, please give us your time.
Thank you, moderator. The Honorable Minister of Health, Madam Aisha, Prime Minister Focal Point, my sister, UNICEF rep, Dr. Jama, the global director of polio eradication, my friends, Aziz, all distinguished guests, colleagues, Dean, and all distinguished panelists, friends, college students, professors. Assalamu alaikum, very good morning to you all. I'm honored to be accompanied today by such a prominent panelist. I'm thankful for Aga Khan University for co-organizing this event with WHO, for hosting us here in Karachi. I'm also thankful to Pakistan for the leadership, the commitment to protect millions of children from paralytic disease, with the vision to safeguard the future generation, not only for Pakistan, but across the world. During last decades, Pakistan has played a vital role in promoting global public health, eradicating polio worldwide. Shukriya. Thank you, Pakistan. Ladies and gentlemen, eradicating polio forever and for every child is not just the right thing to do, but it's also smart things to do. Recent detection of poliovirus in Germany is a stark reminder. Poliovirus knows no borders, that the future of millions of children are unstopped. Science is telling us eradicating polio forever in Pakistan across global is within reach. Science also tells us, ladies and gentlemen, it is no time to quit. It's time to recommit. WHO will stand with Pakistan and partners until we cross together the finish line. I'm convinced that today's discussion will be another important step in the right direction. But to success, it is crucial we intensify together our last push to build a polio-free world for every child, no matter where they live, who they are, and those children are our children and our grandchildren. They are our future. We must not fail them. Shukriya, thank you.
That's very true that we have achieved a lot of goals over the period of time in polio eradication. And one of the goals is that we have actually eradicated wild poliovirus 3 and wild poliovirus 2 from Pakistan. The only thing which is left behind is wild poliovirus 1. For the opening remarks, I will request Dr. Azra Fazil Pichu, Minister of Health and Population Welfare, Government of Sindh, and she's one of the most approachable ministers and open for suggestions. Thank you, Dr.
Bismillahirrahmanirrahim. Assalamu alaikum, ladies and gentlemen. Good morning to our foreign guests. It's a pleasure being here in Aga Khan because Aga Khan always keeps hosting these events, and I keep coming to many of these events, and so I'm quite familiar with Aga Khan's layout, and I've worked here as well, actually, in my salad days. So I would like to welcome Ms. Aisha, the focal person for polio from the federal government, Prime Minister's focal person from the federal government. I would like to also welcome Chris, Sylvester, Jamal. Thank you for being with us. Your audit has opened eyes to a lot of shortcomings in our polio campaign. This is the last mile, and obviously we need all the help that we can get to reach every child with polio drops in every campaign so that we can eradicate polio from Pakistan. It's not only an issue of Pakistan, it's an issue for the world because obviously we can export the virus as well. So really speaking, eradicating in the last two countries left, Afghanistan and Pakistan, we need to pull our socks up and work hard to achieve. The last mile is actually very difficult to achieve. It's the one that, the small pockets that we're missing, the numbers are of infected children are reducing, but at the same time, the parents are also asking the question, why now, again and again and again? And the answer is, still children are getting infected. And obviously the numbers may be small, and people say, you're spending so much energy on polio. Talk about why are you spending so much energy on polio, and there are so many other diseases which are more prevalent than polio. And polio, we may have it in the environment, and every district of Sindh unfortunately has the virus. But the thing is that we are very close to eradicating polio, and we need to eradicate it to make our children safe. And we did that with smallpox. I don't see why we can't do it with polio. So having said that, I feel that It is a struggle. Needs conviction, it needs dedication, and it needs a lot of commitment from all our workers. And I'd like to here praise our workers, our field workers who go out in the heat and the cold and the rain and snow and go and do an effective campaign. There obviously is now a lethargy that is setting in the polio campaign, and we are quite aware of it, and hopefully we'll be able to address those issues that have come up through the audit team. I'd also like to thank WHO for hosting this and Aga Khan University. Dr. Kareem, thank you very much. Lua, thank you very much for WHO has hosted this event in partnership with Aga Khan. Aga Khan University has been a partner for us in many, many areas, including infectious diseases, IPCs, infection prevention control protocols, etc. Also in COVID, you name it, they've been partnering with us, and I'm very grateful to them. Now we are also partnering in nursing. So there are a lot of things that we are partnering in, and hopefully we will continue being excellent partners. I think private-public partnership works very well, and Sindh is an example of how even the institutions and universities and academia come into play and work with us to ensure that we have a healthier Sindh. So thank you very much for hosting this event. I'm very, very grateful to all the participants for being here today, especially the students who learn from, I'm sure this panel will have a robust discussion, and your questions will be answered with great deal of insight into what polio is all about. So thank you very much for being here today. And I'd also like to appreciate foreign guests who have come all the way from various places to be part of this and the initiative that all our workers are taking. Thank you very much. Today is a landmark day. We're going to, not only are we trying to reach the last mile, but we hope that within a couple of years, we have made Pakistan free from polio and our children safe from this curse. Thank you very much.
Thank you, Ma'am Minister, and very rightly said that as a team, we can always achieve, and the mile can be a kilometer or a meter or a centimeter or a millimeter. Before we go to the panel discussion, we have a very important keynote address, and that has to be delivered by Mr. Aziz Memon, who is the Global Polio Eradication Initiative representative and Chairman of Pakistan's National Polio Plus Committee, and Rotary leader recognized for decades of services in health and eradication nationwide. Thank you, Dr. Aziz.
Bismillah ar-Rahman ar-Rahim, a very good morning. We have the Prime Minister, focal person, Senator Aisha Raza, all the way from Islamabad, welcome. And our own Minister, Dr. Azra. The WHO head, our beloved, we respect you and we love you. We have so many foreign delegates here also. And I've been meeting individually, but you know, I just want to recognize one friend of mine who disappeared and who has reappeared, and that is Chris. It has been an honor and a pleasure to come and speak to you. The GPI Global Partnership has been there since 1988 and has done a lot of good work. And we will continue with that till we finish our job of making this region and the world polio-free. The positive samples in Hamburg also have been a message that till we are not done, it can pop up any time. So we have to, and the world leaders also need to see this, that this mission of health needs support. All the support, including financial support. Without that, no mission can ever be completed. Now, when we started this GPI, there used to be 130,000 cases. So many children were dying also. From there, it used to be 125 endemic countries, and now we have come to where we are just fighting with the last two, Pakistan and Afghanistan. We hope that we will get over that. Rotary has been part of it, the champion of polio eradication from the start. And when we started it alone. But the subsequent year, WHO and UNICEF joined us, and eventually it became the GPI. So I would like to quote, with the permission of my foreign delegates, a couplet from my famous poet, Majru Sultanpuri. मैं अकेला ही चला था जानिब मंजिल, मैं अकेला ही चला था जानिब मंजिल, लोग साथ आते गए और कारवां बनता गया. So the poet says that we started it all alone, but we had friends meeting us, and for GPI, Gavi was the last to join us. But we value the addition of Bill Gates. It has brought more gist, more life. Other than the money, he and his name are a great blessing to us. Thanks, Bill Gates. Now, my friends, the younger Rotarians and friends, they ask, polio and Rotary made such a big commitment. How come? There were two main reasons. In those days, the eradication of smallpox was making headlines. So this point was discussed. I was not there. This point was discussed: if smallpox can be eradicated from this world, why not polio? This was one. The second, why from Philippines? We gave first grant of $360 million. The director at that time was from Philippines. He later on became Rotary president, retired in San Francisco and died long time back. One day, he said, Aziz, you must have tea with me in my room. I want to tell you something which was not written in the papers. I said, sure, Mr. Capacho. What he told me was the main reason for requesting the grant for advocacy in Philippines was the resistance in North Philippines from the Muslim fundamentalists. Why I'm telling you this? Because you see, there is a link from the start to what we are doing today. We'll get over it. I was just telling the WR that last month in Cairo, when myself and Senator Aisha Raza were there, I had the pleasure of spending half an hour with a gentleman, intellectual, Dr. Muhammad Abdi Jama, a genius from Somalia, another genius from Somalia sitting in front of me. So he told me that he was heading WHO in Pakistan in the year 98, 99, 2000. And from there, from Pakistan, he went to Afghanistan and then retired. And now the regional director has him as an advisor. He's in good health. So he had a lot of stories. He worked very closely with my predecessor, past Governor Aga Khan, may his soul rest in peace. So he told me that, those days, there was not so much of resistance. The government of Pakistan used to buy their own vaccines. There was no killing, no problems. And I recall that when I joined Rotary, early 90s, we used to wait for the NIDs. Because during the NIDs, we would put up the tents and that's something which is called the shamianas and take the flask. And the families used to bring the children for taking drops. Those were the good days. And then, in those days, we did go to Kabul, but not to give OPB. We went to Kabul, I hope no press is here, just to enjoy the nightlife of Kabul. Yes, and have fun there. It was not 500 years ago, it was just around the corner. My friends, the invasion of USSR, that Union of Soviet Socialist Republic, in Afghanistan in 1979, and the world powers getting down there, creation of Taliban's, that disturbed the demography of the region. We are a sufferer. We are sufferers in many things. Now the climate change. We do not create or generate the carbon, but we are the sufferers. We are the sufferers because we get the flooding, the glaciers melt, and we suffer. So, unfortunate. Rotary so far has contributed $3 billion, B as in boy, since the start, just for polio, and for Pakistan, $500 million. We have no intentions to stop or to give up. We want to tell this audience and the world that we will be there till we finish the work. We don't give up. Pakistan today has got a Prime Minister, Shahbaz Sharif, fully committed for polio eradication. When he was Chief Minister of Punjab also, he used to have sessions with me and he would say that I want to take the routine to 80% and 82%. We have all 4 chief ministers, including our own Murad Ali Shah, fully committed. Dr. Azra, big support to us. She has served in many positions. Give a round of applause to Dr. Azra. Prime Minister Shahbaz Sharif has done many good things. One thing I want to mention is that he brought back a Prime Minister focal person, Dr. Aisha Raza, to finish the job. Thank you. There are challenges. If you are running a rally also, the last mile is difficult. For those who are into cricket, you know, when the batsman crosses 90, it is a difficult time because 90 to 100 is a tough job. When the fire extinguisher go to put a fire, they keep on waiting. You tell them now the fire is, no, they said, sometime, you know, the sparks come out from the ashes also. So we'll be here. We need to be here. We will complete the job. Today, the surveillance in Pakistan, Jamal told me, and Afghanistan is something which is superb, unbelievable. The virus cannot hide from us. We have a team. We have partners. We love and respect our partners. This partnership has paved many ways for Rotary in our other projects also. We quote to them that look at a partnership with WHO and UNICEF. And while I stand in this Aga Khan auditorium, let me add that we have a partnership with Aga Khan University also. And we do not need permission from anyone to start a new project. We recently did a project of $500,000 with the president of Aga Khan University. No, at that time it was Firoz Rasool, for malnutrition. The first project we did with Aga Khan was in East Africa, and that was training of the midwives. That was a big project we did. And the result of that was it reduced the infant mortality. We can do several more projects. My friends, you have a panel discussion, you have other people to listen, so I will not take much of your time. To the students who are here, I will tell them that today they don't have to study a chapter on smallpox. It is gone, it's history. Now, what we want from you as the health leaders of tomorrow, let us put polio in the books of history so that the generation which follows you will not study smallpox, will not study polio also. I will leave you with two thoughts from a person whom I admire and respect and whom I met several times, Nelson Mandela. He used to say, literacy is an instrument by which you can change the world. And when we talk of literacy here, we want to concentrate more on female literacy. A literate mother will not shut the door on the face of the vaccinator. She would open it and welcome. Let's hope we do that. And another thought of Nelson Mandela was, it is always impossible. It always looks difficult till not done. Today, it looks, people say that even the media, how will it be done? But that is always there till the task is complete. And when it is complete, it is gone. We will do it. We will make the world polio free. Thank you for listening to me.
Thank you, Aziz. It's really great to hear very good insight, and I'm sure in the future generation will see as a past and no more chapter on the polio in textbooks of pediatric and pediatric infectious diseases. And this will be present as a case history or case study for many generations how the eradication being done. So in this group of individuals, we not only have the people here, but also we have online people, and we have more than 150 participants online who is able to hear you well. We have representations from the UNICEF Pakistan, WHO, National, International Pakistan. We have the Emergency Operations Center leadership is here. We have the Pakistan Pediatric Association leadership here. I can see Dr. Jamal Raza is here, Dr. Maiman, who is the head of the PERC. I also see the chair of National Immunization and Technical Advisory Group, Dr. Khalid Shafi here. So I think I would say it's a powerhouse of people who are here today, and I can clearly see that it's a very good discussion coming up soon. So in my panel discussion, I would like to invite the panelists, and they can be seated on their respective seats. So the first is Ms. Aisha Raza Farooq, who is the Prime Minister Focal Person for Polio Eradication and the Chair of National Commission on the Rights of Child. She's a former senator and Sitara Imtiaz recipient for leadership in child health and polio eradication. Thank you, ma'am. Mr. Aziz Maiman, would you please join us? All right, yes, I'm sorry for this. Yes, I forgot, yeah. Dr. Jamal Ahmed, who is the Director of Polio Eradication in WHO headquarters and the Chair of GPEI Strategy Committee. He's a veteran in global surveillance and response system across Africa, Geneva, and Pakistan. Thank you, Jamal. Dr. Christopher Maher, who's the Senior Advisor for Health Emergencies and Response, over 30 years in public health and immunization, former Chief Scientist for the Global Polio Program. Dr. Sebastian Taylor, who's the member of Technical Advisory Group in Polio Eradication, supporting evidence-based strategies and innovations in South Asia and globally. Dr. Shanaz Ibrahim, she's the chair of Pakistan's National Certification Committee for Polio Eradication and head of pediatric neurology at Aga Khan University, leading Pakistan's certification and health education efforts. Thank you, Dr. Shanaz. Dr. Ahmed Sugair, Sugair is a polio coordinator for WHO Pakistan, managing one of the largest polio programs globally focused on vaccination and surveillance, and he is a proud AKU alumnus as well. and myself is Ali Faisal, who will be the moderator for this. Can I have my caller mic, please? So I just want to make sure that I just go to the team as well. So before I just have my caller mic on. Yes, thank you. Hello, hello. Yeah, perfect. Great. So I'll go for the questions, for round of questions with all of you at once, and then I go to the audience and I request audience to please identify yourself, your designation as a student or a faculty or whatever, and then ask questions. The first question is always tough, right? Always to start with the government, right? Isn't it? So for Ms. Aisha, what has been the progress made by Pakistan in polio eradication in last 3 decades, both in terms of cases and in terms of response of the outbreaks? You should turn it on. Is it? It's okay.
Thank you. So Pakistan started its formal eradication efforts back in 1994. And I think since we have managed to reduce the disease burden in the country by 99.6%, In early 1990s, Pakistan had annually 20,000 polio cases, which are down to double figures right now, 30 so far this year in the country. 2 of the 3 strains of wild poliovirus that were circulating then have been eradicated, and we're only battling the WPV1 right now. And of this particular strain, the genetic diversity that we see is also increasingly squeezing. How have we come this far? Through establishing sophisticated network of emergency operation centers across the country that are driven by scientific and data-based operations, which are constantly evolving given changes in technology or virus diversity. And through that, of course, we reach 45 million children under 5 years of age in each of our polio campaigns. Pakistan also today boasts one of the largest and most sensitive surveillance network in the world, which allows us to stay ahead of the virus and help plan our program accordingly. We also have a world-class polio reference laboratory which supports not just Afghanistan but also regional countries. We also have developed indigenous capability of risk assessment, risk through scientific modeling, which allows us again to respond more effectively to changes, whether in the virus, in the virology, or otherwise around the country. And I think it's these strengths that help, and these became really the backdrop in which Pakistan's COVID pandemic was very successfully led also through our surveillance, through our emergency operations center networks. And I'm very hopeful that given this use of technology and strong program, we will be able to cross the finish line very soon.
Very soon, yes, inshallah. So for the Jamal. So I'm also a Polio Sage member and working with headquarters for last many years on many vaccine trials in Pakistan, polio. So Jamal, you sit at the top and you see a lot of things going on the ground level and the country's level. So for you, how close are we to eradicate polio in Pakistan and worldwide? Knowing that there is a wild poliovirus and circulating vaccine type poliovirus as well. What is the science telling us?
Thank you so much, Dr. Salim, and again, good to see you, and it's good to be in this wonderful hall. I was telling Chris earlier, it reminded me of Aga Khan University in Nairobi, the whole decor and the way things look like, and I almost felt at home immediately. But just on the question itself, when we talk about polio, many of us here, especially on the panel, have different kinds of history at different stages. My first interaction, I think, was in the 90s in Turkey. There was wild polio there, and the European Union hadn't, the European region hadn't been declared wild polio free. They had insurgencies in the southeast, and they pushed. I was skeptical. I was one of the students in medical school. I was doing my medical school there. And I was very skeptical. I was like, okay, this virus, this war going on, things are happening in Iraq across the border. Is this possible? It became possible. It was done. Okay, I paid attention. And then I was back home in Kenya, and I was working at the district level as a district medical officer of health. And we had viruses across the border in Somalia, big, so spilling over. And civil war. Areas controlled by inaccessible populations. And again, the same simple question, is that possible? Is it doable? And then it was doable, and it was done. And I was like, okay, it's doable. And the story continues. We had in the Horn of Africa outbreaks also that spilled over from Nigeria into South Sudan, which is again conflict-affected, geopolitical challenges in the Horn of Africa. They were able to finish. And then the big thing happened in 2011 when India stopped. It was the biggest challenge, the biggest mountain to climb. After that, everything was supposed to be much easier. And India did it, and they finished. From then on, the question of is it medically possible is gone. It is no longer a theory. There is a practical evidence that difficult geographies across the world, in Africa, in Asia, in the Middle East, have done. So the vaccine does work. It has taken care of already type 3 and type 2 in Pakistan itself and in Afghanistan. So the theoretical questions about whether this is possible is gone. The question for us is it doable here? Can we step up and say, okay, Pakistan and Afghanistan will also finish and the whole world will finish? To me, looking at everything that is happening everywhere else, I'm a strong believer. I've seen it also, Syria do it in the middle of a civil war. So I firmly believe the medical data is very, very clear that the vaccines, whether it is OPV, IPV, and the combination of both in different stages, do deliver enough immunity to knock out this transmission. What we need is us now to really believe it, including our medical students, and for us to mobilize and finish it here in Pakistan, starting from here in Karachi. And if we do that, the world will be polio-free. Thank you so much.
Thank you, Jamal. So I think you just pass on to Sugair, and Sugair, he see the world from the Geneva, right? And you are rightly based in Pakistan. You are here for last how many? 5 years or 6?
3 years.
3 years, right? So Sugair, what is the science behind polio operations in Pakistan? Operations in terms of seeing outbreak or a campaign thing, and what are your partners in this whole operation system, and how you look into the challenges you faced over the last 3 years?
Thank you very much, Dr. Ali, and good morning, colleagues. It's always good to come back here to this institution. Yes, as Jamal said, the science is being evident and is being holding through, and even the tools that we apply this science are now even improved in terms of technology and whatever. So theoretically, we must be even in a better position to do it. Yeah, basically for my colleagues here who are students and many of them studying this infectious disease epidemiology, to target a disease with eradication, you have some principles. The most important 3 ones, this causative agent, which is a virus in terms of polio, it has to have some evidence-based tool to control it. And we have the vaccine here. The second criteria is to have a well-established diagnostic criteria that will help us to establish a surveillance system that will enable us to see what is going on and what is needed to be done. And if we are done, finally, it's all about the diagnostics and surveillance. The third one, this causative agent, this virus, it has to have it has to have a life cycle within the human body only, and it should not replicate in the environment or in any other vertebrate or any other animals. So all of these are well met in polio, and they continue to be met, and they will continue to be met. So we are not having any doubt of that. Now coming to the next step, how to make this science work. So we have to address all of these principles. For the vaccination, you have to have the classical trade-off between the supply and demand. So the partners here with the government, they are doing their best to do the best level of excellence to deliver this vaccine in the supply part. We have vaccine procurement that is done by colleagues from UNICEF in the partnership. We have the vaccine team trainings and team micro-planning and the method how to deliver this. This is all done by WHO. Then they have some monitors and they have some data. It's also supported by WHO and national EUC and provincial EUCs and government systems. Then when we come to the demand part, we have to have sets of the social behavior communications, and here the UNICEF is leading that within the partnership. Then we need to have some higher level advocacies. Here, this is the role of the Gates Foundation, Rotary International, and also we need to have some bridges with the existing health systems, including EPI, and within the partnership, usually Gavi help us with that. So this is the roles of the partnerships. Coming to the third point of these principles is the detection and diagnostics. And this is now supported by a large scale of surveillance system, and that is led by WHO in this part, with support from the CDC in terms of the analysis, in terms of genetic analysis that we need some backup from specialized laboratories from CDC and whatever. So to come back, all of these science fundamental points are met. They will continue to be met. The only thing is up to us how to make it right, how to apply it right. Thank you.
Thank you very much, sir. So good. So let's move to Dr. Shahnaz, right, who has the thing in her hand, certification, right? Right, Dr. Shahnaz, you chair the National Certification Committee. So tell us about this committee, because you are not from any organization, you are from an academic institute and leading this certification committee. What happens to, what needs to happen for Pakistan for certified polio-free, and what are the steps and time for these certifications?
So thank you, Ali. Yes, it's a big responsibility, especially when you are not the frontline worker and you are reporting, you know, everything that is happening in your country, and you are the person answering back to the regional certification committee, and then they go and do it to the GCC. So it will take 3 years of being polio-free, no case, no poliovirus in the environmental samples. 3+ years to be classified as polio-free. And it cannot just be Pakistan, it has to be both Pakistan and Afghanistan as a unit. So when we say that we are going to get polio-free, both the countries have to go together. That's the first. And when we are, when I am reporting, or when we are looking at what areas you want to see the actual AFP rate, because it is not just saying that we don't have polio. It is important that we see what is the AFP rate, and we are doing very well on that. Of course, there are certain gaps in certain areas where the reporting is low, but overall, Pakistan is way above on that. The adequacy of the stool, which should be greater than 80%. The timeliness of the reporting of the cases, and then the 60-day follow-ups. You also need to see whether Pakistan is prepared for any outbreak response. You need to see whether they are catching the migrant population, because those are the difficult areas. The South KP, which is our main problem. South KP is where we, where we need to do something really fast and really hard. And so the silent areas. And then the zero-dose polios. I think, there is still, we've done humongous work since the 90s. I've been here since the 90s, and I remember being told by my chair that any AFP case comes, I am on call to see whether this is polio or GBS, and do not ventilate the polio, please. Because we were stuck with 2 children who, and we still have her. Yeah. We have a 33-year-old polio survivor who's ventilated, fully functional, has a motorized car, motorized wheelchair, has a ventilator which is mobile. So we are taking care of her. And so that is a very, horrible situation to be in. And so we've come a long way. But I think, the last mile, as Mr. Aziz Maiman said, is the most difficult. And when you're running a marathon, the last mile is, I've run marathons in my life, and the last segment is when you want to give up. So, but you should not.
Thank you, Dr. Shahnaz. It's really encouraging. So I moved to Sebastian, right? Sebastian. Tell us what fresh approaches and technologies such as AI, digital mapping, and GIS mapping actually help us in planning and monitoring in Pakistan and how this works.
Okay. Hi, everybody. This is my first time to come to Aga Khan University. It's a delight to be in such a beautiful campus. On the way here, we were presented with a quite long list of potential questions which we might be asked. This was the one that I was hoping I would not be asked, because I'm not a specialist in AI and geotech and so on and so forth. But it did start me thinking, as all good questions should. So thanks for that. There are good examples of the way in which geolocation has been used to track vaccination teams, to get better confidence that they are covering the areas that they've been tasked to cover. That can feel a bit punitive from the point of view of the vaccinators themselves, so it has to be very carefully introduced. That's all I'm going to say on the tech side of things, because actually I think the program, much like a lot of other public health programs, needs to recall the underlying lesson, which is you can have all the tech in the world that you want. If your basic functions on the ground are not properly constituted, it won't help you get the job done. And that takes us a little bit back to the work we've been doing over the last few days, which I think, Madam Minister, I think we talked a little bit about this, is taking us back to those basics. Are the vaccinators properly trained? Are the vaccinators properly tasked? Critically, are the vaccinators properly supported to feel like the job they're doing is a worthwhile job that they can do, and maybe even, and I hesitate to say this because there are other people who are involved in the money side of this program, but even have a longer term prospect of the development of their working lives. Because absent those things, it's much more difficult for them to find every child in every house in these areas. And having flown over Karachi a couple of days ago, one is reminded of how unbelievably complicated and huge the challenge is in this context. So absolutely, with all the best will in the world, introduce technologies as and where you think they fit, and they enhance what you have already put in place in human operations. That's what I would say. Thanks.
I think that's great, and thank you. Before we will go to Christopher, I just ask audience to be ready, because after Christopher, I will give the floor to the audience to ask the questions. But I think Dr. Shanaz talked about, Christopher, about that Pakistan and Afghanistan taking as one group, right, for the eradication. So tell us about this, and also what lessons Pakistan adapt for other countries who actually have eradicated polio.
Thanks, Sally. I was just admiring Seb there. It reminded me of a boxing match I watched recently where the boxer was successfully dodging the punches. He successfully dodged the question and counter. So, look, there are, I wouldn't say hundreds, but certainly dozens of examples where you have issues of communicable diseases, and polio in particular, that are common to different countries or different administrative areas or different whatever. This is not necessarily an immutable thing. I mean, particularly for polio, the issue is not the fact that there is a particular line in any area. The issue is, do people from one place go to the other place? And that is what creates the dynamic of shared reservoirs of transmission. And certainly they have, in the past, there have been a number of periods of a history of years in which Afghanistan and Pakistan had very active shared reservoirs. But then there were other periods when those shared reservoirs became much less important, primarily around the issues of were people moving backwards and forwards, yes or no. So there's not to me, it's not a sort of an absolute given that there is always going to be this elephant in the room of shared reservoirs, and that you can knock it off on one side, but if you don't knock it off on the other, it's going to be reintroduced. There's an element of truth in that, but it's not necessarily, it's not necessarily going to operate as a significant dynamic all the time. I think that's the key thing. So ideally, in all parts of the reservoir, you knock it out at the same time. But that's pretty hard to do, and historically we've struggled with that. Jamal was talking about northern India before, and I mean that was we had years when we'd succeed in knocking it out of one place, and then it would still be going over here, and 6 months later it would get back into the place that we just succeeded in knocking it out of. And I did have a full head of hair once upon a time. I had curly hair, and it wasn't grey. But northern India took away my hair and left me in the situation that I'm in now. I would say, though, it's a factor that we've got to always be considering. But I also think that the last point that Seb made is actually the most significant one. A great deal of eradicating polio is just around really basic stuff. It's Stone Age stuff, it's not incredibly technically complicated or anything like that. It's pretty basic. You find children and you get vaccine into them, and if you do that consistently enough and often enough, polio goes away. And the circumstances are very, very different in different places, and we're not. The other thing is we're not doing this in a vacuum. If this is not a science experiment, we're doing this against the background of social changes, political changes, climate changes. We're doing it in very, very different environments. The environment of Karachi is infinitely different to the environment of rural northern Nigeria. These are just such different places, and it affects everything about the way that the activity is implemented. But when you come down to the base, the commonality is there. It's just getting to those kids, putting the vaccine in them often enough that you don't have any circulation of polio anymore. So I think a number of countries learned from Pakistan. I think Pakistan has also learned from a number of other places how to do things. Dr. Aisha mentioned before that the surveillance systems in Pakistan in particular now, but Afghanistan also to an extent, are orders of magnitude above the sensitivity of anything we had in the early part of eradication. I mean, we didn't have environmental surveillance, didn't exist when for the first 8 years that I was working on polio, we didn't know what it was. We didn't have genetic sequencing. We were making it up as we went along, basically. So the sophistication of what exists now is remarkable, and it also affects our perception of what's going on, because in the past we didn't have these tools. So we weren't finding as much virus as we are now. Now we have all these sensitivity tools, and we're finding the stuff everywhere and shocking ourselves, but it's not a valid comparison to look back and say, well, we weren't finding it then, why are we finding it now? We didn't know that. We didn't have the same tools that we have now. That was a very, very long-winded answer. My apologies.
Thank you. So I open the forum, and may I request Dr. Thubani, and after that, Dr. Khalid Shafi. Dr. Thubani, can the mic to Dr. Thubani? Dr. Thubani, please. Please introduce yourself, Dr. Thubani.
My name.
Dr. Thubani, may I request to? Yes, thank you. Yes.
My name is Sohail Thubani. I'm a pediatrician at AKU. And this question may reflect my ignorance, and the question is open to anyone in the panel. What, in your mind, are the most significant challenges to eradicating polio? It's a two-part question. The second is, and what possible solutions do you think there are for those challenges?
Thank you. Thank you for that question. We get asked such questions all the time, and we question ourselves also. So if you would ask me currently what the challenge has been, despite Pakistan coming very close to eradication twice before, once in 2018 when we had been able to reduce case numbers from 306 down to only 2 in one district, Dukia, Balochistan, and much more recently in 2021, when for 14 months Pakistan had no human polio case. If we look at the case burden right now, 30, and how they're divided, I think one of the challenges we face, of course, is access challenges. We talked about South KP, which is proving to be most difficult, because when our vaccinators don't have access to children, of course, how do you raise their threshold immunity to a level where they're protected against polio? The other is, in places like Karachi, constant population movements. There are in other areas of Balochistan, elsewhere, where we have weak health infrastructure. We have our routine immunization coverage not up to the level that is required, which helps our efforts towards polio eradication, and to their operational gaps also that we're paying attention to. The basics has been spoken about over here, which we're concentrating on. And then, of course, community resistance, campaign fatigues. We've been doing this for so many years. The risk perception for polio is pretty low. Communities do not see children affected by polio. These 30 children that we have affected from polio today have very weak paralysis. And thanks to a very strong surveillance system that has picked these cases, mostly asymptomatic. So how do you tell people that this is a serious disease? My communications teams try to get these, through their permission, get these children to be a part of a communication campaign, but I've told them, hold on, because if communities see these children running around, how will that help us raise the risk perception? But having said that, of course, there have been instances, we keep telling them, the reason they're asymptomatic and weak paralysis is because the program is reaching them. In 8% or 99% of the country, you're reaching them with vaccination, but not enough to build their immunity to a level required to protect them from polio completely. It's like COVID. You were COVID positive without symptoms also. So we're having a hard time convincing at times provincial governments also, who are at times contesting cases and saying, hey, how is this polio? And we tell them, no obvious symptom does not mean that the virus is not there, but it's a good sign for the program. But I think we need to keep doing whatever we are, but we need to do it better, through better operations, the basics, concentrate on that. We need support of all young doctors, students over here. I'm told many a times pediatricians are not supporting you and saying, hey, you shouldn't be vaccinating them so often. So really, I'd like to reach out to all of you to please help us. We are so close to interruption, to making history, to preventing and working for our children so that they never, ever have to face this disease ever again. Thank you.
Thank you, Dr. Aisha. But I think I just want to add here that pediatricians are one of those forces that, I'm here. So pediatricians are one of the folks actually who actually do a lot of vaccination, not only public, but also the private sector, right? So I would like to acknowledge my own colleagues who are here, who actually helped in those vaccinations. We have a next question from Dr. Khalid.
Assalamu alaikum, Dr. Khalid here. My ask is about, as a pediatrician,
please, can you please introduce
as
yourself?
a pediatrician, because
Khalid, please introduce yourself.
I'm Dr. Khalid Shafi.
And?
Okay, as a pediatrician, I'm asking this, that our ultimate goal is to healthy children and control the VPDs. My ask is about the EPI and PEI synergy. This is a golden opportunity. By virtue of these polio campaigns, we are reaching every children, and now we are detecting the zero-dose children also. But in spite of these efforts for the last few years, there is not much increase in our routine immunization. How we can make this EPI and PI synergy more effective? So it's a long-lasting thing. We will eradicate polio in the next 3-4 years, inshallah. But the VPDs will be there, and we need our children to get the maximum routine immunization. Thank you.
Khalid, who you think who should answer this question? Chris, would you like to take that? Yeah.
I'm delighted to have a shot at this one. Thank you very much, sir, for that question. Look, I do not see any fundamental issue with improving basic immunisation coverage during the process of eradicating polio. This has been done in so many places. Cambodia, when we were working there in the 1990s, was in the middle of a war and had just come out of a genocide that killed something like 25% of the national population. In the start of when we began polio eradication there, it was 1992. immunisation coverage, basic immunisation coverage in Cambodia was something in the region of 20%. In the course of the next 5 years, Cambodia eradicated polio and tripled their basic immunisation coverage. So there is nothing, there's no law that says while you're occupied with eradicating polio, it means that everything else deteriorates. Not at all. It requires coordination, planning, the investment of energy and resources to make sure as much as possible you're pursuing these synergies. And you made the point very, very well, sir. One of the things that house-to-house polio campaigns do very well is identify children who've not had access to the immunisation system before. So does AFP surveillance. It will identify children who are unvaccinated in the routine system, giving us an entry point to go down and see if we can improve the way in which service is offered to these people and how they can access the services we have. So, I mean, I could, forgive me on my hobby horse, I could have go on for another 25 minutes and bore the hell out of anyone. But my basic point is it is eminently achievable to do both things with the right inputs, energy, and the right spirit.
Yeah. So you want to add, Senator Aisha? Yes.
Thank you. So I think that's very important. But I'd just like to share here that only 2 days back at the National Emergency Operations Center, we had a joint meeting with all our partners and our DG FDI, and we worked hard as both in the polio, PEI, EPI, to put together a synergy framework. So there was in the past a lot of conversation, discussion of the advantages of synergies and integration here. And we were already, without formalizing it, the polio program was has been sharing 0-dose children's data with EPI. And the coverages were dwindling in the range of 30 to 40%, but they've gone up across the country. Somewhere much better, 80%, others 60 to 70%. However, that formal synergy framework has now been jointly put together with the provincial teams, with in ICT, with the federal government also. And I'm very hopeful that on the communication side, surveillance side, operational side, both teams will help each other and create the integration, which is not so difficult as it seems to be, to see how we can work together to raise essential immunization coverages also in the country and help each other.
Thank you. Jamal, want to add?
Just one addition.
Yeah.
I want to go too much. We have positive experience in Pakistan itself, and we've seen simultaneous push to enhance RI in Peshawar. I remember a few years back, it was very low in many of the union councils in Peshawar, and they were able to boost over a number of a year or two, and it has remained relatively high compared to Balochistan and many other processes. So I think it is doable, and we have positive experience also here in Pakistan.
Yes. All right. So we have a lot of questions. So,
Thank you.
Dr. Jamal.
Assalamu alaikum. I'm Dr. Jamal Raza. I'm Executive Director, Sindh Institute of Child Health, and also the ex-president of Pakistan Pediatric Association. So I would first like to respond to Senator Aisha's thing that some of the pediatricians are not supporting. I would just like to clarify that from the association point of view, not just we have been supporting, we have been at the forefront. The whole country, the Pakistan Pediatric Association is the organization which is supporting the campaign right from the word go. Now the worry is that, two things. Despite the number of cases dropped down from 74 to 30, we still see a lot of environmental samples, and we are seeing a lot of refusals. I was reading a report this year, and in Sindh there were 42,000 refusals, and out of them around 40,000 in Karachi alone. So there's clearly a fatigue factor, and as a common man, not as a scientist, of course we want this to succeed as soon as possible, but we, as a common person, you fear that maybe we are doing the same thing and expecting different results. So could you, somebody will want to respond to that?
Yeah.
Thank you.
Please. Stephen?
Okay, that works. Yeah. Hi. Thanks for the question. Yes. Yes, that's right. Fatigue. I think we have to be very realistic about this. First of all, I think when you look at the data relating to the program, the question of refusal has become too big in our estimation of what is going on and what the problem is. The program then ends up spending quite a lot of its capital and quite a lot of its time, of which it has a limited amount, as we can see from the screen behind me, covering a relatively marginal bit of the problem, whilst at the same time not getting a relatively poorly defined group of missed children who are perfectly willing to be vaccinated. So I think there's a question about how you distribute your attention between these types of problems, and you have to do it based on the evidence. Now, these numbers that you were talking about, yeah, I mean, we recognize that there are the rates or the incidence of refusal is not insignificant, but it is too significant in the way in which the operation is trying to respond to it. And if I may, just on the question of fatigue, I'm not a big fan of this idea of fatigue. On the demand and the supply side, to go to your point, on the supply side, the program is unbelievably hard-working, from the ground all the way up. And when people say, oh, but the vaccinators are getting tired of this, well, you know, everybody gets tired of their work sometimes. Actually, the evidence that I see in front of me in Karachi over the last couple of months has been extremely positive on that side. And then on the side of the households, I don't think, I mean, I think if I were, to be perfectly frank, if I were living in my house in East London and somebody came to my door once every 4 or 5 weeks and said, vaccinate your children with this thing, which, by the way, I haven't particularly explained to you, I would probably say no to. And that's not because I don't trust vaccines, I do. It's not because I don't trust this vaccine, it's not because I don't trust the frontline workers, it's just because I have not been told why this is happening. And so when we classify a household that says, I don't want this time, as a refusal, we're making a mistake. Particularly when we classify it as a refusal and we say the reason for this refusal is, quote unquote, misconception. And when you ask, what was the misconception? And they say, well, they believe that they're being given too much vaccine. That is not a misconception. That is a legitimate scientific question. And we have to be in a position to answer it.
Yeah. Thank you. I just need to rectify one thing, because the audience there cannot see. Can you just a little bit back and more, a little more? Is this correct? Can you see, Dr. Era? Confirm me. Thank you. Thank you. And what about the audience there? Can you see? Yeah? I'm not sure. All right.
Professor Dr. Iqbal Biman from Park, Sindh, and I've been member of the NETAG some years back, and also ex-president of Pakistan Pediatric Association. I will endorse what Professor Jamal Raza said about PPA being the forefront, and I think it has been as a leader in this whole process. When you come a bit later, most of the aspects of the polio questions are already addressed, but I would like to say this, and this is from public perspective also. We had so many NIDs. From 94 onwards, I think we are counting and probably has over the 100. And they report we are more than 100%. Every time it's 100%, 110%, 120%. Then there are gaps, obviously. That's why we have circulation. So have we looked at those? I'm pretty sure we have. And are we not so successful in addressing those gaps? Or what is the reason? And second part, EPI routine vaccination, RI, is one pillar for eradication polio, one of the important pillars. And synergy is coming so late. The word synergy has come back, has been coined lately, but it hasn't really happened. And that has not been pushed. And every time I think those who are in the process of eradicating polio do acknowledge that RI must be pushed upwards for being able to make sure that polio doesn't come back again. I think we need a lot more energy into this and much more planning into this, and I would appreciate if that is going to be expedited. There are some rise in numbers, but not enough. Thank you very much.
Thank you, Dr. Mehman. So maybe we can have a question from the students, because there are a few, and then we can ask yes. So one from there and one the third row, and then we can request Dr. Sajid want to ask Dr. And Dr. Faisal as well. Yes.
Hello everyone.
Yeah.
I'm Dr. Zoya Hassan. I'm working as a research specialist in Department of Pediatrics and Child Health. My question is related to WASH and social behavior change. In Pakistan's High Union Council, where there is poor sanitation and vaccine hesitancy coexist, so how is the EOC integrating WASH and social behavior change strategies to reduce polio transmission and improve polio campaign acceptance?
Dr. Aisha, you want to take?
Thank you, Dr. Zoya, for that question. And I think we realize, so I'm going to talk about RI and integrated service delivery, and then hand over to Jamal to talk about why these are important. I think the program has done a lot of introspection to see why we've come so close twice before and not been able to interrupt transmission. And one reason we see is low coverages of routine immunization or essential immunization in our core reservoir areas. So we can't sustain this unless you raise essential immunization across. Having said that, there is no quick fix there. Essential immunization takes longer, but we are prioritizing that in our high-risk districts. And with the help of Dr. Azra here, similar efforts are underway. At the same time, we've also realized that in areas like South Khyber Pakhtunkhwa, where it is difficult for our teams to access and take 2 drops of polio to every house, we are concentrating on integrated service delivery, where we think nutrition, wash, sanitation are areas that the program is now delivering to gain community's trust. 2, we think we need to work there also, because wherever we have polio right now, our communities where there is weak health infrastructure, there is poor sanitation, they're malnourished, undernourished, and all these are complementary strategies. They don't take over, cannot take over the door-to-door SIA strategy that we have, but they're complementary, and that is why we're looking at those also. So very, very important, and that's the model we're using in South Khyber Pakhtunkhwa. Till we cannot go door-to-door, we have community influencers helping us through site-to-site vaccination, but concentrating at the same time on all the others also. Jamal, would you like to add to that?
Yeah, no, thank you so much. I think maybe I'll start with the data. And it's good to see you, sir, after some time. It's wonderful. On the data issues, the program is very sophisticated in many ways. Yes, you may have administrative data sometimes that do highlight more than 100% of our target population covered. But the program will not only rely on just that one single data point. There are so many other sources of information that we use. And the current actually work that is going on, led by Chris Maha and SEP and many others, which is to do an in-depth audit of field level performance and assessment, just indicates how serious the program is in identifying those gaps, those areas that are unreached. Even a program that is as good as doing its work as this still has to perform at a very, very high level in a city that is so populated, so dense, with so many other challenges, like Karachi, to reach zero polio. It's not a minor achievement. And the fact that the program was able to do one way or another over the last 5, 6, 7 years, twice, reach that kind of zero transmission itself is a big, big deal. Having said that, when it comes to the PEI synergy, you are right. I think there has been some work that was done. This is not something that is new. I remember in Gadab in Gujro, there was substantial investment in terms of enhancing routine immunization, getting, boosting health centers there and health posts, making sure we have vaccinators. The Singh government, the minister, honorable minister is here with us. She's not new to polio. She has been many years at the forefront, and the push to make sure we have the right health officers, the right high number of vaccinators. But polio still doesn't, polio is a zero-sum game. If it doesn't completely disappear, it's a transient issue. It comes back with a bang. And we are dealing with that now. We are dealing with that resurgence after a number of years of cumulated susceptible populations, a number of years of missed children. And that's why we are seeing this environmental surveillance. And then on the last thing, because there was a very good WASH question, the first thing to remember, because is when we detect something in quote unquote the environment, this is not like some of the other pathogens, say, what can I say, like malaria or something like that, where you have mosquitoes and others that are spreading. It just means effectively that somewhere within that community upstream, a child or a person is shedding that virus directly, and we are picking it. We haven't identified that person because, quote unquote, either they are asymptomatic and they are part of the transmission chain, or they are symptomatic and the system wasn't able to detect. And we are using, therefore, the sewage sample or that sewage runoff as a proxy to identify whether there's some silent transmission, some other circulation going on within the community. Now, the answer to then will be to identify what are those missed lacunas of populations and to vaccinate those populations so that you interrupt that transmission. It is effectively a signal, almost like an early warning when you have tsunamis, when you have an early warning and the tsunami is coming. You want to make sure you don't have a case. You want to make sure you don't have a paralytic case and deal with that. So you want to respond in advance. And that is the value of the wastewater surveillance system, the environmental surveillance system, and it has been phenomenal since it has been introduced, and it's one of the reasons why you don't see a high level of cases nowadays when you have an outbreak. And on the WASH, I absolutely agree. Investments, we are working. Polio is just a small program within the broad health agenda. UNICEF is our co-partner as WHO, and they have a lot of work that is going on through the WASH programs in different areas that are at risk. So it's not that that is completely being forgotten. That's not true. It's going on and it's being done in a powerful way. Thank you.
Yeah.
Do you mind if I just quickly add? I know there are other questions, but I think it's a really important question, and it kind of ties together a few things that have been discussed so far. I think around the mid-1980s, there were a couple of meetings in Northern Europe amongst specialists to define what were called criteria for eradicability. In other words, how eradicable was a disease. And when you look at the reports from those meetings, what really stands out is that most of the assessment is focused on the technology, to go back to your earlier question. Most of it is focused on whether you have a viable tool, right? The question of social, political, economic viability was way down the list, right? That kind of explains where we are today, I think, in this context. You were asking, I think, what are the biggest challenges? Well, the challenge might be the question of OPV versus IPV and so on. Actually, I think the biggest challenge is social disparity. It's marginalization. It's difference in economic experience between different parts of the country and the population, which takes us then to the question of refusal. And in some of those cases, because I don't discount the question of refusal, in those areas where you've got very dispossessed communities, they are very annoyed. And when they see a program which has a global spotlight, this is their one chance to say what they've got to say about the condition of their lives, and they say it. And you've got to respect them for doing that. And that takes us to the WASH question. Thanks very much for that, by the way. And there, the end game for WASH is that you have a country with a full-fledged sanitation system. But that costs a great deal of money and takes a long time to do. The other end of the spectrum would be to hand out buckets of water, which nobody is going to be fooled by. So the real question, programmatically, is where do you want to pitch this program between the bucket of water and a fully fledged system? How much can we offer in terms of social development around the program as we deliver vaccine? Thanks.
Yeah, but I think just to add on that, we have the same type of circumstances like India and Bangladesh and other countries, right? We have the same kind of problems in WASH and others, open sanitation and others. But again, the problem goes back again to identify the children, and when you just say, just identify a simple thing, identify the child and vaccinate them. We have more questions from the audience, yes?
Yeah, hello. Hello everyone. My name is Noman Khan. I am the provincial manager with Aga Khan for Balochistan chapter. In particular, I am managing the Gates Foundation's flagship investment in Balochistan to strengthen routine immunization in 7 high-risk districts for polio. I was making a presentation for Michael Galway earlier this year, and in one of the slides I was telling him the story about the cases of polio in Balochistan. And the number of cases in 2014 were 27, and that's the year when the emergency operations centers were established around the country. And in 2024, the number of cases were also 27. So my question to you as experts of public health is, what do those numbers tell us? Does it mean that we just lost a decade of efforts and money and literally the lives of the workers for nothing, or is it just a minor hiccup?
Yeah, we can start. Thank you very much. And this is a very important question. What does a number mean? Actually, doesn't mean anything for us.
Yes.
We're aiming for 0. If number matters in the journey, we would have been now got the highest, repetition, because we control the poliovirus the best that can be done. But that is not our aim. Our aim to reach 0, to eradicate the poliovirus from any human body, from environment, and even from laboratories through our containment component of the strategy. So this to cut it short. But to explain it, why I'm saying this number does not matter. Yes, they matter in terms of the prediction models, as Jamal said, in terms of early signs, where are we going well, where are we going wrong. But it's not a point for premature success or a point of depression or frustration if they go up. In the history of eradication, I think Jamal said India. By December 2009, more than 700 cases were there. 12 months? By December next year, and January 2011 was the last polio case in India, and that's it. In Nigeria, same thing in Kano, where hundreds, one of them is the last. That's it. So we believe one of these viruses will be the last one, and that's it. And as far as we are in the same track and we are going well, things will be reached. Jamal.
No, thank you. Also, I hear what you're saying. I get the kind of frustration that you may feel when you see 14 in 1 year and effectively about the same number of cases. So the first thing you have to remember as an epidemiologist is the cohort is shifting. Every year there's a new cohort that is being born. And every year the work restarts effectively. And so you're not dealing with the same 10-year-old. That child that you're dealing with 10 years ago is now 11, 12 years old. And you're dealing with children that are born afresh. So that's the first mindset that you understand. Like every time when you're dealing with public health issues, the clock resets continuously. And that's why building the routine immunization is very, very critical, because then it begins to catch those children early on as they're born and as they're coming into the system. So number one, that is very critical. The second thing that is linked to that is to understand what will have happened if you don't do it. Again, that's another public health question. Sometimes you don't see, to paraphrase the poet, the road not taken. If you do not do any of that, and Senator Aisha had highlighted, Pakistan had 10,000 cases, and that was at a time when surveillance was not super, clear, and when the population was a quarter of this. You can imagine the thousands and thousands and thousands of children every year that will have been paralyzed. So between then and now, imagine if you did not do any of those interventions and things were like that. You would have had tens of other thousands of children who are now adults and teenagers who are living with polio, paralyzed, and a burden on the health system. And there are all other interventions that are there. So the work of those frontline workers, we have to really appreciate them. Many of them have sacrificed their lives. They've given all their efforts. And that has had an impact on people who are today living and working and surviving, who are now teenagers, who are in school, who are doctors. And the goal, the ultimate goal is to reach zero, as we said. But as we do and we aim for that zero, let's not forget the positives that we have already achieved and where we have reached. So thank you so much.
I think, Jamal, you mentioned a very important point about the life lost during these campaigns. I think Pakistan Polio program is the only program where the vaccinators gave their life, their blood, sacrificed their families, and go to the communities. And I would like to thank all of them who actually participate in those, right? Those who not only serving today, but also served in the past, lost their life, and we should applaud them, all the vaccinators. Dr. Khalid Mahmood?
I have a small comment.
Yes, okay. Yes, Dr. Khalid, then Dr. Sajid, and Dr. Iram, and then.
My question is not to the 6 innocent people sitting here. My question is that all the questions came for the learned pediatricians. My question to you is that what is your role? What is your duty? When a baby cries, the mother brings to you, not to Senator Aisha. You have an important role in improving the routine immunization. You see, a mother has trust in you. A mother cannot trust the vaccinator who has just opened the door and come in. You are spending time with the mother. I feel that, I'm talking to these, young mother lovers. The pediatricians have a responsibility. I'm not talking of Aga Khan, across. You work in Kachhi Abadis also. And then you have a proper knowledge of the hygiene, of the care. You guide on milk, you guide on everything. So routine immunization is not a 1-hour job like giving OPV. It's a long thing. And I feel, I do not want an answer to this question, because I was listening. So I thought, let me tell you also that you have a role. Please, do it and we'll do the job. Thank you.
Hello. Thank you for the opportunity. The last mile, as already been mentioned, is very challenging. But the optimism, faith, trust, and the belief that not that we shall, but we will eradicate is infectious one. My question is a bit intriguing for me, and I'm inquisitive at the same time. And my question is basically addressed to the stalwarts from abroad. Players keep on playing. We have been struggling and we have come a long way. The point basically is lookers on see most of the game. Now the people who are sitting on the other side of the fence, I am interested, please list 3 important problems that you have identified that we have not been able to eradicate polio so far, in an order of priority, so that maybe we can work overtime and achieve our goal. Thank you so much.
Who want to answer that? That was my last question, actually. You stole my last question. Let's go.
So I noticed that suddenly the microphone seems to have appeared in my hand. I think, we could. It was striking me as we were talking, and this is something that has been in my head pretty much ever since I've been working on this. Is everything we do is we're doing it really for the first time. And although we say, yes, of course, we've done 100 campaigns, yeah, absolutely. There is experience that we have gathered. There is enormous amount of expertise that we develop. There's new tools. There's all of these things that come. But all of these things are being developed while we're going through this process of eradicating the disease. And so, you know, you can't be really definitive about anything until it's actually done. And then you can kind of look back and say, oh, well, look, yeah, maybe maybe that was the truly critical thing. When we did that, that was what really made the difference. I would say one of the biggest issues that Pakistan has faced, because of a lot of the unique dynamics that exist around society and geography and whatever that exists here, is being able to achieve consistency of quality over the whole country at the same time. That has been a real struggle for the program in the past few decades. That at different times, the program has really been incredibly effective in certain parts of the country, but in other parts of the country, it just hasn't managed to hit the levels of quality. And then you concentrate on those parts and fix quality issues there, and it would have deteriorated in the other place. So it's the consistency of quality, I think, is a real serious challenge for the program in Pakistan, complicated by the diversity of the country, which is pretty extraordinary by any standard. That's one big issue. I don't want to retreat from the comments I made before about the basic elements of the work. If we have to solve anything, we have to solve the basic elements of the work, which is reaching families and children with vaccines, and that's the bottom line. If we can't fix that issue to the point where we can consistently reach the vast majority of kids in the country with the vaccine, we're always going to struggle to get rid of the virus. Yeah. So I don't think there's any particular blinding light or anything like that we can say, now if we concentrate on this thing, it's going to be perfect. I think it's much more boring and basic than that. It's there's nothing. Sadly, there's no sort of star quality about polio eradication. It's a grinding fight. There's a gentleman called Isao Arita who used to be he passed away now some time ago. He was one of the leading lights of smallpox eradication, and then he was the chairman of the Regional Technical Advisory Group in the Western Pacific when we were eradicating polio there. Isao said to me once, he said, everyone forgets this. He's a small Japanese man. Everyone forgets this, he said. Eradicating polio is like wrestling with a gorilla. Even when you have the gorilla down and you've got your arm around the gorilla's neck and you're choking the gorilla, you have to think, if I let go, that thing is going to get up and rip me to pieces.
That's true.
Yeah. It's a lovely analogy. It comes back to the issues that we're struggling with now we have so little polio. I mean, in comparison with so many other programs, everyone thinks, why are we spending so much time and effort on this? The reason is if we let go of the gorilla's neck, it's again going to become a problem that's going to haunt us forever. So, sorry.
Thank you. Dr. Ajit?
Thank you, Faisal. I'm Sajid Sufi. I'm Professor of Pediatrics and Director, Center of Excellence for Women and Child Health, South Asia. Working in polio program and polio eradication efforts since 2014. So during last 10 years, it's a lot of time very hopeful and a lot of time very disappointment. So number it doesn't carry any values. The polio virus is circulating everywhere. in most of actually the low prevalence vaccination coverage. So when the circulation is there, you can't say that we have the 27, or even with 0 case, you are not confident that we can eradicate the polio. So some encouragement here, actually the dedication of the federal and provincial governments. I personally witnessed Senator Aisha hard work and dedication, Dr. Azza and Dr. Anwarul Haq. It's a lot of actually the dedication. The issue is low immunization. The vaccination coverage in Balochistan, 45%. With the 3% fertility rate, every month we have a new heart without vaccination. In Karachi, the 0 dose is less than 6%. But when you calculate in numbers, it's the huge numbers in thousands. So without focusing routine vaccination, we cannot eradicate polio. This is number one, actually, based on my experience. The other is this: we have to change the strategy of do Qatre to some more incentivized approach towards the communities. Thank you.
Thank you, Dr. Sajid. And I think it's a more of a comment, and we discuss. You want to? Yeah, go.
Thanks very much. Again, I mean, so the question over there, talking about optimism being infectious. Evidently, it's not that infectious at this point. But it illustrates a really important point, I think, about the way in which we approach our thinking about the program over the last 10, 20 years, today, over the next period of time. Should we be pessimistic? Should we be optimistic about where we are? Personally, I'm not a big fan of optimism and pessimism. I think they're unhelpful emotions. Actually, I think what we should be doing is focusing on the problems, understanding the problems, solving the problems. And then the world is going to do what the world does, and ultimately I think that will play out. But I think we see these kind of quite powerful narratives. The program is going wrong. The program will succeed. They're not that helpful, I think. Let's just focus on the fact.
Yeah, I think, Dr. Iram, you're the next. We have 2 more, and then I have to stop. I'm sorry.
Okay.
Yeah, because we have...
Hi, Assalamu alaikum. I'm Dr. Iram Khan. I'm a microbiologist. And as a microbiologist, a lot of infectious diseases that are we struggling here in Pakistan are waterborne, and that includes polio as well. So my question I know WASH has been talked about, and there's a lot of strategization that is involved, but one of the simplest strategy that as a microbiologist I know is the chlorination of the drinking water. And my question to the provincial ministry and other ministries over here is how much committed we are and how much effectively we are involved in helping the water systems over here in Pakistan, at least in big cities where water supply is available. I know there are cities where water availability in it itself is an issue, but where the water is available, how much committed and dedicated we are to improve our chlorination in those water plants. It's because that will take care of not only polio, but Vibrio, cholera, that infection, typhoid, hepatitis, all that we are struggling with. So that's my simple question. Thank you.
Thank you. Who want to take that? Dr. Azza, want to take that?
Yes, thank you. Thank you, Iram. I would address that question as, are we not water scarce in Karachi? We are. We have 1,100 metric tons of water we need for Karachi, and we only have 500 metric tons of water. Most of them not supplied through the pipelines. And so in a central chlorinated pond, where we can chlorinate the water and send it through the pipelines, it's not done here. The water is distributed through tankers, and those tankers carry the virus and carry a lot of other bacteria and viruses as well. So as an infectious disease person, you're well aware how much we are struggling with waterborne diseases because of that. And it's the same case everywhere. Our sewerage is mixing with our water supply system, and that is causing a great deal of huge burden on the health systems for eradicating, not only eradicating polio, but also for combating with typhoid, with hepatitis, with cholera, with every other disease that is waterborne, gastroenteritis, for instance. And we always see those peaks and troughs coming in of all these infectious diseases. I think the wash question was very pertinent. The basic principle is that we should give clean drinking water to every person in this country, not only to our children, but also to adults and everyone. So we are not being able to do that. We have a World Bank program, a WASH program for World Bank, and we are engaged with that we should be giving not only proper toilets to the people, and not so that they don't go out into the fields, etc., but also to give them clean drinking water. So there's a big WASH program coming in with World Bank. At the same time, we are also looking at distribution lines in all our cities and districts. Also, the fact of the matter is that you cannot, we did distribute chlorination tablets to the water tankers when we have a rise in infectious diseases, but unfortunately, obviously, we can't reach out to every water tanker and every source of water that we are this thing. Our water tanks within our houses are contaminated also, because when the flooding occurs, the whole area becomes contaminated, and that's what we are facing. So I agree, that is our requirement, but unfortunately, it is a huge, huge burden on the exchequer, and the finances for this are not available, that we give clean drinking water to every person, but we are trying our best. In Sindh, at least I know, we are trying our best. Thank you.
Yeah. Thank you. And I think one of the important way to go about it is having a mucosal immunity in the gut of those kids. And the only way to give mucosal immunity to these children is give oral polio vaccine. Because you cannot clean the water, which is everywhere, but 2 drops will actually give them mucosal immunity to protect the virus. If they go into the gut, they can kill their... Professor, you want to go last?
Thank you very much. And I would like to speak on behalf of my pediatrician colleagues. So I'm Faiza Jahan. I'm a pediatric infectious disease specialist and an epidemiologist. And sometimes when you're working in the trenches and at the forefront, you do lose sight of the big picture and things do start looking gloomy. But clearly, we have made a lot of progress, and it is showing in all the discussions. Clearly, there are also challenges that we need to address. But the good thing is that those challenges don't appear like ghosts. I mean, they look like real problems, to your point, that need to be addressed in an objective manner. My question, actually, I don't know if it's a question or a comment. As a pediatrician, I really feel that parents have lost the recognition or the importance of immunization. And that's not just for polio, it is for routine immunization. And I do think that we as pediatricians are not doing enough to get that recognition back. Now, we may not have the same problems of hesitancy that we are seeing in North America and in the American regions right now, but we do have a lack of information and knowledge. And the thing with infectious diseases is, and you have mentioned it yourself, that if something is so good, the vaccine is so good, that it reduces the disease to a level where people just recognize, they lose the recognition of the importance of that preventive strategy. So I think the media needs to play a more important role, and you need to call out the media, and this is especially to the government, because I do see all these news in the media with regards to previous campaigns, not polio campaigns, but other vaccine campaigns. They do end up playing a very negative role. So they have a very important role in bringing that, the refreshing people's memories. Oh my God, this is what measles used to look like. Polio causes such severe paralysis and death. When we did not have an effective vaccine, that many children died. So I think that powerful message needs to come back, and it needs to be there. We need to do it constantly, continuously, powerfully over a long period of time. I do not see much, much in the news and no noise around the importance of vaccination overall. So, yeah, everybody in this room is responsible for it.
Thank you, Dr. Faiza. And lastly, I think before we end, I may request each of the panelists to give one message, take-home message. Start from you.
I thought I'd run out of take-home messages. I thought the gorilla was my take-home message. Now, the last encouraging thing I would like to say is one of our colleagues, I think Jamal, was talking about issues in northern India, and I was very much involved in eradication in India. And I remember in early 2011, the last case of polio in India was January 2011, I think. It was February or March, we had an Indian Expert Advisory Group meeting, which is the equivalent of the technical advisory group you have here in Pakistan. And the IEAG in India was an extremely aggressive body. And I was sitting with Sunil Bal. Sunil was the deputy chief of polio eradication in India at that time. And we were exhausted. It was about 8 o'clock at night. We had to go into this meeting again the next day and get attacked by the members of the IEAG. And he turned to me and he said, I don't have any ideas anymore. I've run out of ideas. It was exhausted. I was exhausted. We went to bed. We didn't know it, but India had already had its last case of polio. So it's just to encourage you. When you think you've absolutely run out of energy, other people have been there before you. So please don't stop. Keep going.
No, thank you. And just to build on that energy comment, as you can see, we have old warriors here, and so we are in Aga Khan University, one of the preeminent universities in Pakistan. So we really need the energy of the new generation of public health and medical professionals from this university, from other universities. We need your energy, we need your spirit, and we need your advocacy. You are, I think, much better than us even in communicating on social media, on many other forums. So please get involved in whatever way you can, whether it is a message to your families locally or major advocacy. Be with us, be with the community, and we look forward to ending polio here in Karachi, across Sindh and across Pakistan. Thank you so much.
Thank you.
Thank you. I think I'd just like to end by highlighting once again that while there is polio anywhere in the world, nobody is safe, and the recent detection in Germany proves that. And repeating what Aziz Maimun said, this is not the time to quit, this is the time to recommit. And we have all of you, our partners, health pediatricians, young and old, more experienced, have supported us so far to come this far. And I mean, for the sake of repetition, the last mile is the most difficult, and for reasons in Pakistan it is. But please, we need your support. We need you to be with us. We owe it to our children. We can't fail our children. We can't fail our grandchildren. Not those polio workers, not those security personnel who've laid their lives for this cause in Pakistan. And I don't think we've seen this scale of challenge anywhere in the world. So for their sake, for our current generation's sake, for the sake of the children in this region, in the world, we have a historic opportunity. We cannot let it go. We have to give it our best, and it is impossible only when it is made possible. And I think we can, all of us can, with your support. And I'd like to thank Dr. Kareem, the Dean, Aga Khan University, WHO, Dr. Azra, UNICEF, all our partners from abroad and here, and all young doctors in the making, all young doctors. Thank you once again for your support. As Jamal said, when I talk about polio, people don't believe me. She has a vested interest to finish this, and she's saying things. They believe each one of you. And that's why I said that, we need warriors like yourselves to help us join the fight, even more now than before. Thank you.
Yes. So I work at the Royal College of Pediatrics and Child Health, which is an unnecessarily long name. But the reason it's not called the Royal College of Pediatrics is because they recognized when they were establishing it that child health is the result of lots of different things. amongst which pediatricians are one, but they're a really important one. What I find really puzzling about Pakistan often, and not just in the case of polio, but since we're talking about that now, is the amount of capacity in the country, the extraordinary levels, the high levels of capacity that are available here, and yet we still struggle with what is essentially a very basic task. And I think, you know, the people in this room, particularly, I'm not discounting the seniors and the elders, but particularly the younger ones in this room, this is your time as pediatricians to go out and say things. How you say them is important. Don't get into fights on social media. It doesn't work. Find good ways to say it, but don't lock yourselves into your pediatric clinic. Go out in the world and talk about what you're seeing, because that's where people will see real credibility, and that changes the picture. Thanks.
Thank you. I don't think I have a lot more to say other than what has been said before. But I have a lot of experience seeing actual polio cases, and they were terrifying. I still remember bulbar polio. It's not a very rare condition. If you have polio, there are very high risks to get bulbar polio, and the child will die, not just paralyzed. And I've seen the face of the child who was ventilated, because we had 2 children already ventilated in our wards, and the parents had left them. And the 3rd child, I remember the face where there was a committee. We said, I think Dr. Thobani may remember this, where we actually disconnected the ventilator. I was crying and bawling my eyes out. I do not want to go through that again. That was the most horrifying day of my life. And so it is, so it's not mild, it's mild now because we've been doing this. And if you were to see through my eyes of those horrifying experiences, it is so hopeful for me that we are going to go zero polio, and I am sure we are going to do it.
Yeah, thank you very much. I think today we demonstrated some part of the health for all, and it should be by all. Everybody has to have a role of that. Yes, I remember a quote from our senior colleague, and who's Mike Ryan, who was the Deputy Director General for WHO, and at the same time, he's a profound global polio eradicator, including serving here in Pakistan. He always say, currently the world has very little good news. It's all full of bad news. And polio eradication can be the good news that we can make. So I think this is a very good point to send and to take home. Let's be part of this good news that we give to the world. Thank you.
Thank you, panelists. May I request to please be seated? And you guys are amazing audience. I would like to thank each one of you. Before we go to the closing remarks, I would like to request Dr. Deeping Love and Dean Karim Damji to please on the dais to give away the mementos to the panelists. Dr. Deeping and Dean, yes. Deepang, yeah. First, yes, can you please take it? Slow, slow, slow. To first, I would request Dr. Azra Pichu to please come forward and receive their memento, and then the panelists will come and then you stay. That's the plan. So we just don't want it to. And, yes. And Dr. Azra, please stay so you can give the mementos to the panelists. So the second for my list is Mr. Aziz Maiman. Thank you, Aziz. Senator Aisha. Dr. Jamal Ahmed. Christopher Maher. Dr. Sebastian Taylor. Dr. Shanaz Ibrahim. Dr. Sukair. May I request Dr. Damji to give a memento to Dr. Deepan?
Thank you.
All right. We're good. Dr. Kareem, can you please come and give a closing remarks?
Bismillahirrahmanirrahim. And so good afternoon, everybody, and I'll try and keep the remarks short. I just want to acknowledge the support and the dedication of all those that are here. It is wonderful to have all gathered together, our Health Minister, Dr. Azra, and our Senator, Dr. Aisha, all of the WHO colleagues that are here, and UNICEF colleagues, the Pediatric Association and societies. But amongst us, there are academics, there are students, there are advocates, there are frontline workers, researchers, and all of you are dedicating energy, time, knowledge, your lives to this important cause. So I think we should give ourselves a big round of applause. And that the journey, of course, based on the shared commitment, ethical responsibility, and promise to our children needs to continue until the eradication is done. You know, one other thing that I was reflecting on is the importance of leadership, but also of partnership. And allow me to quote the words of our late Chancellor, Prince Karim Aga Khan, who expressed a truth, I think, that speaks directly to our collective mission. He said, "The greatest progress in maternal and child health comes when leadership is joined by partnership, when governments, communities, and development institutions work as one. Even the most challenging environments can witness rapid and profound change." So, you know, at AKU, we are grounded in the reality and the principles of ICRA, impact, quality, relevance, and access. And we are here to remain as a steadfast partner to contribute rigorous research, meaningful partnership, interventions that benefit people. And I just want to acknowledge Dr. Faiza, Dr. Ali, Dr. Shehnaz, all of those in the pediatrics department for your leadership and contribution, all of those in CHS and other departments that are doing good work, because I think altogether we can contribute to this important knowledge creation and knowledge for the benefit of those that need it most. And so thank you to all the stakeholders here. And above all, I also want to think of the frontline healthcare workers, often women, who carry trust on their shoulders and hope in their hands. And the last mile to polio eradication, based on what I'm hearing, is within sight. It demands persistence, knowledge, humility, empathy, and innovation, but most of all, that we work together with a community-engaged model and continue to walk together on this last mile. Thank you all very much.
So the last memento is for the Dean, and Jamal, can I request you to please give word to the Dean? As a moderator, I have a lot of responsibility. Thank you. And we have a last photo together, so may I request the photo will be taken from here, and all of you just squeeze together. All of you come in the middle, so the photographers can come to the front.
Fix it.
Perfect.